This week's concepts, I will be covering some important concepts and information about the topics. Be sure to take notes and also refer to the required reading. Smoking has been proven harmful effects on children. So children with respiratory disorders such as asthma have an even greater risk of complications from secondhand smoke. If a pediatric client with asthma has a parent that smokes cigarettes, the nurse should educate the parent on how to create a smoke-free environment, such as smoking outside or away from the child. Other options to discuss can be focused on reducing the amount of smoking or a smoking cessation program. The nurse should give advice to the parent about e-cigarettes, and they're just as harmful as traditional cigarettes. We do know with the e-cigarettes, if the person or the child comes in contact with the oil that is in the e-cigarettes, then it is toxic to them. Avoiding pet dander, mold, smoking, and dust is essential. So you want to identify what those triggers are for asthma. Stuffed toys, usually they're not desirable. I know they're all nice, but they're just usually not desirable because they collect and hold on to the dust and things from the environment. Humidity in living areas of the house should be controlled to between 25% and 50%, because excess humidity, anything that's above 50%, it promotes mold growth. And we do know that mold is toxic, even if you have asthma or not. Dust collectors such as carpets, upholstery, or drapes should not be in the bedroom with a child that has asthma. So those things will need to be removed if they are in there. And or don't put those items or things in the room. Mattress covers, foam rubber pillows, and cotton blankets are preferred. Wool, down, and feathered stuff items should be avoided. Upholstery, drapes, and carpets can be sprayed every 3 months with benzoate or arcansan to kill dust mites, followed by cleaning and vacuuming. You might need to use HEPA filters. The use of HEPA filters, air filtering devices in the bedroom, and HEPA filters in the vacuum is advisable. You can actually get those filters that actually go inside of the vacuum cleaner itself. The use of HEPA air filtering devices in the bedroom and HEPA filters in the vacuum is advisable. You want to identify triggers of asthma for each child. It's helpful because it helps you control the symptoms. Now, each person might have different triggers. They may have some of those triggers in common, but it's probably going to be different for each person. Children may be taught to monitor their own lung function with the use of a peak flow meter at home. The parents and teachers should not exclude the child from physical activity in school because of fear of that trigger in asthmatic attacks. In children with exercise-induced asthma, pre-treatment with short-acting beta agonists before scheduled physical activity or activity will prevent the asthma attack. So you do have those that exercise causes an asthma attack. So what do? You pre-treat. You administer the inhaler before the physical activity. And you want to provide that teaching. You want to do that teach back method where the child is taught to monitor their own lung function so they can determine and be proactive when they might run into, the when an asthma attack is pending. So you want them to monitor those peak flow values. And that's a teach back method too. You can have the child and the parent demonstrate and then discuss or explain just to ensure that they understand the procedure and what the numbers actually mean. Regular checkups are recommended at least every 2 years to assess growth and development. Immunization boosters are recommended between 4 and 6 years of age, and again at 11 or 12 years. Annual vaccinations against influenza is the most effective way to prevent flu. Now they're even saying that the COVID vaccine might be even a yearly vaccination. Antiviral drugs, however, are important treatment options for children who get the flu despite immunization or who were not immunized and are at high risk for developing complications of the flu. These medications are available in pills, liquid, and inhaler. Parents should be taught to recognize the signs of pain in children who are ill or recovering from surgery, to understand how to manage pain with medications or non-pharmacologic means to prevent undue suffering or discomfort. This just means no medication. Sometimes it's a position change, sometimes it's a room temperature change. It could be a warm towel. Those are non-pharmacological agents. A test for iron deficiency may be appropriate for the child who is not eating well because they're not getting all the nutrients that they might need. So that test might need to be done because the child may need to take a supplement. Nutrition and healthy childhood weights are being evaluated at earlier ages because obesity are increasingly nationally for preschoolers and children ages 6 to 11. When a child enters preschool, a physical examination that will include a urinalysis, a vision test is often required. The examination may reveal health problems that are not obvious so that early intervention can occur. Children should be physically active for at least 30 to 60 minutes per day. That's every day. A growing child, they're supposed to be up and moving. The American Academy of Pediatrics guidelines recommend no television, smartphones, or computers for children under the age of 2, and less than 2 hours of screen time per day for children and teens. These activities have been linked to an increase in attention problems, development of unhealthy eating habits, higher body mass index, and obesity. While students seek assistance from the school nurse for illness and injuries, they often seek reassurance or hide in the clinic. You're the school nurse, you are the go-to person for the staff as well as the students. Students who experience bullying or abuse may also come to you, but they're reporting physiological symptoms. And for the most part, you may can identify that if the child's coming at the same time of day and you've done your assessments, interventions have been done, and that child continues to come back. There might be something else going on besides that child is really being sick. They might be experiencing bullying. The school nurse should assess circumstances that led up to the physical symptoms. And that's when you're doing your assessment. You're gathering more information so that you can determine an appropriate intervention. One of the Healthy People 2030 goals is to reduce firearm-related deaths. Gun violence is a risk factor for accidental injury or death among children when evaluating a homes for safety that has firearms. The priority for the nurse is to find out where the firearm is stored. Firearms should be stored unloaded, locked, and ammunition stored separately in a locked device. Asking about who has access to the gun, the purpose of the gun, and training for the use of firearms is important, but not the priority. So the priority is evaluating the home for safety that has a firearm. The priority is finding out where is that firearm stored? Where is it at? Is the ammunition stored in the same place? Those are things that need to be looked at. Treatment of a child with infantile eczema is aimed at relieving pruritus or itching. You want to hydrate and lubricate that skin to relieve inflammation and preventing infection. Efforts should be made to identify triggers or recurrent relapses. An emollient bath is sometimes prescribed for its soothing effect on the skin. Oatmeal and a mixture of cornstarch and baking soda are examples of an emollient prescribed. The infant's hair is washed with a soap substitute rather than shampoo. The healthcare provider may suggest that a bath oil such as alpha curry therapeutic bath oil be used as the lesions begin to heal. This prevents the skin from becoming too dry. For correct use, bath oil should be added after the patient has soaked for a while and the skin is hydrated. In this way, moisture is sealed rather than excluded, as it is when oil is added before the patient gets in the tub. Whenever possible, patients are treated at home because of the danger of infection in the hospital. When soap is used, a mild, non-perfumed form such as Dove or Neutrogena is used. Glycerin-based lubricants are preferred over lanolin, which may be an irritant to an infant who is allergic to wool. Aquaphor and Uracin are creams that can be used to enhance skin hydration. White petroleum or Vaseline costs less and is effective. And get enough of that Vaseline. In 2017, a non-steroidal PDE4 inhibitor, Crisparol, received approval from the FDA for the long-term treatment of mild to moderate atopic dermatitis in children over 2 years of age, as it may reduce the need for steroidal creams. Corticosteroids may be administered systemically or locally, but they must be monitored for the side effects, such as skin atrophy or systemic effects, such as adrenal suppression. Antibiotics may be needed if an infection is there. Medication to relieve itching is ordered for the patient. A child who is uncomfortable and unable to sleep due to itching may be given an antihistamine. Non-steroidal topical ointments such as Elidel or Protopic are used for children over 2 years of age when steroids are not used or not effective. But long-term use can be avoided. Systemic corticosteroids are not routinely used, as this treatment can be followed by a flare-up of atopic dermatitis when the dose is tapered or discontinued. Cyclosporin medications are immunosuppressives and increase the risk for infection. Antimetabolites such as mofetil and methotrexate can be prescribed in severe cases of atopic dermatitis. These drugs, they do cause immunosuppression, so it helps one thing, but then it can cause problems with the other. Phototherapy may be prescribed, but long-term use may cause adverse effects. Allergen immunotherapy, prebiotics, and probiotics, Chinese herbal medications, and vitamin D are all investigational. Avoiding irritants and identifying environmental triggers are helpful. Due to the difficulty focusing, children with ADHD may need reminders to take their medications. Some medications may decrease appetite, so the school nurse can partner with parents and teachers to ensure that children do not experience nutritional deficits. There is no need to isolate the child for meals, and there's no evidence that indicates a child needs a tutor or a behavioral contract. So when you are assessing a child for scoliosis, the nurse looks at the back of the child bends forward for general, and you're looking for general body alignment in asymmetry. Functional scoliosis is usually caused by poor posture and is not a spinal disease. That's functional scoliosis. It's caused by poor posture, not sitting up straight. Like how to say, sit up straight. Acute conjunctivitis presents with itching, burning, erythema, and purulent drainage. Bacterial conjunctivitis is easily contagious and requires antibiotic therapy. Therefore, the child will need medical evaluation. Warm compresses, not ice packs, are used for the management of symptoms. The child can return to school 24 hours after antibiotic treatment begins. To prevent the spread of infection to the other eye, the child will need to teach hand washing, The greatest impact to anyone's health, especially a child, is financial stability of the family. Children from low-income families have an increased risk of disease and injury. Decreased finances impact the family's ability to assess preventative health care. So the person do not have finances to purchase and subscribe to the insurance. Then when the child gets sick, the family is less likely, not to say they will not, but they're less likely unless there's some type of resource in the community that allows for services to be provided without insurance and there's no cost, or there may be a low cost to the family. But the greatest impact on a child's overall health is financial stability of the family. Children from low-income families have an increased risk of disease and injuries. Decreased finances impact the family's ability to assess preventative health care. The home environment, location of schools, and the parent's medical history can all influence the health outcome of children, but they're not the greatest impact. The WHO consistent with Healthy People 2030, describes 3 overall determinants of health: the social and economic environment, the physical environment, the person's individual characteristics and behavior. The WHO also notes that individuals are unlikely to be able to directly control many of the determinants of health, and this is directly related to vulnerability. The 7 WHO factors the World Health Organization are as follows: income and social status. Higher income and social statuses are associated with better health. Education. Low education is linked with poor health, more stress, and lower self-confidence. Physical environment. Safe water and clean air, healthy workplaces, safer homes, communities, and roads and good employment and working conditions, especially when the person has more control, all contribute to good health. Number 4, social support networks, family, friends, and community, as well as culture, customs, and traditions and beliefs affect health. Genetics, as well as personal behavior and coping skills, affect health. Health services. Access and use of services affect health. And number 7, gender. Men and women suffer from different types of diseases at different ages. The single male with a history of a learning disability and sudden unemployment has several potential risk factors, including those related to his social support network, learning disabilities,